Doctors of Reddit, what was your dumbest patient experience? RN here. I see some crazy stuff, but one thing that stands out was the time I was admitting a guy to the hospital. I can't really remember what for, but he was about 400 lbs, diabetic, heart disease, you name it. Anyhow, I am at the computer going over some admission questions with him and his 10 family members who are crowded in the room with him. A few minutes in, he starts complaining that he is thirsty. He needs something to drink right now. So I get on my phone and call the nurse assistant and ask her to bring in some ice water. As soon as the words are out of my mouth, the whole family screams, "No, no water, he is allergic to water." Well, this is gonna be a problem. Turns out the guy had been drinking nothing but Sprite and sweet tea for years because of his water allergy. The next question the wife had was, where are we all supposed to sleep? The whole family, 10 people, were planning to stay at a hospital with him. You can't make this shit up. I work in the ER. We had a very pregnant patient come in needing stitches in her vagina. Turns out she was a realtor and didn't want her water to break while she was showing a house, so she put a glass cup in her pants to catch the water. Instead of using a pad or an adult diaper, she went for a glass cup. She sat down while showing a house and sure enough, it broke and cut her up pretty bad. Was working at a clinic. I was speaking with a non-controlled diabetic patient about her sugar intake, and she said she drinks a 30 to a soda every day. I ask her if it's regular or diet and she replies with it's half regular. I let the ice melt first so there isn't as much sugar in it. Sorry, but that isn't how it works. I have one. I got this from my friend, who is a doctor on the children's ward in a rural hospital. These parents bring in their child whose hair is infested with lice. The lice was visible to the naked eye and could be seen crawling on the child's clothing. While the medical staff examined the child, in order to determine a course of action, they discovered the child was covered in a white powder and smelled heavily of chemicals. They asked the parents what were the substances and the smells emanating from the child. The parents said, quite matter of fact, it was 7 powder and flea and tick spray they used on their dogs on the family's farm. Needless to say, social workers were notified about this case. Not a doctor, but I am a nurse who worked in the OR at a trauma center. Was doing surgery on a 19-year-old who tested positive for meth and cocaine. Who was grilling the anesthesiologist about every drug we were going to use in surgery because he does not like putting chemicals in his body. Gotta stick with that organic, fair trade, non-GMO cocaine. Most of my own stories go along similar lines too. Patient has chest pain driving a coach load of school children. Thinks it's indigestion. Swigs bottle of Gaviscon. Later diagnosed with a huge heart attack. My favorite ever story from a colleague. A patient comes into A&E with abdominal pain. As part of the workup, he gets an abdominal X-ray which shows the problem as clear as day. The colleague has then proceeded to remove, from the patient's rectum, an 8-inch replica of Nelson's column, the statue in the center of Trafalgar Square, London. On showing it to the patient, the response was, "Oh, that's Nelson, he lives up there." Oh, I have 2 good ones that come to mind. Clinical pharmacist here, by the way, with one story in the ER and one in the pharmacy. ER physician told me this one. 16-year-old boy presented to the ER with an extremely swollen, discolored penis. Apparently, he has been using his mom's insulin needles to draw blood out of his arm and inject it into his own penis. He thought that adding blood would help increase his size. His penis was terribly infected and he was hospitalized for a week or so. Second, one day in the pharmacy, a girl comes to the counter requesting a refill for her birth control. We pulled up her profile and realized we couldn't refill it, because she just got a 28-day fill less than 2 weeks ago. When we asked what happened to the other one, she said she was out. Apparently, both her and her boyfriend were each taking a pill each, and was adamant that was how they needed to prevent pregnancy. Optician here. We had a patient who refused to let us use the tonometer, a machine for checking ocular internal pressure to diagnose glaucoma. He said that puff machine gives you glaucoma, and we weren't going to pull that on him. He told us his father got an exam and had glaucoma after using that machine. His uncle and brother also had no signs of glaucoma, and after getting the puff test, both people had been diagnosed with the disease. Glaucoma does not have any outward symptoms before you start going blind. This dipshit just told me he has a very strong familial disposition to glaucoma and refused to be tested for it. ER in here, not a physician, but you may find this interesting. Young adult male presents with multiple abscesses on various parts of his body. States he injected his boyfriend's semen into himself trying to get pregnant. He tells one of the APCs he should have gone with his original plan and tried on his dog first. Psych clears him. He is admitted to the floor and gets antibiotics. What? A related story from my friend, a gynecologic oncologist. Basically, a woman had early uterine cancer, but refused surgery. She wanted to explore alternative treatments like coffee enemas and meditation. She somehow managed to get an audience with the Dalai Lama, who told her to go back to Western treatment. Just got this story from my girlfriend's stepdad, who is a neurosurgeon. He had an Afghan friend who had a couple who couldn't get pregnant. Apparently they had been raised in some religious fundamentalist cult and didn't understand how sex worked. The guy was just rubbing his penis against her leg and ejaculating on her thigh. I had a 350 lbs patient, late 30s, brought in by his sweet old mother, because she was concerned about his recent sweats and shakes. Tell me about his high IQ of over 140. I just nodded and ordered a blood panel. When I got back in the room with the results, he was trying to tell me how he knows more than me about everything to do with medicine. I told him I was diagnosing him with new onset diabetes. He couldn't tell me anything about the pathophysiology of diabetes. Then I asked him which IQ test he took and how old he was when he took it. He said it was an online test a few years ago, like on Facebook. He didn't know what a Stanford Binet test was. Not a doctor but work in pharmacy, an old guy who had got an inhaler prescribed by his GP because he was allergic to his new dog. He came back to the pharmacy and said he was still completely breathless around the dog despite using the inhaler 4 times a day. On further question, it transpired that 4 times a day he was spraying the dog's coat with the Ventolin inhaler. Another gentleman who complained that he was in excruciating pain when inserting his suppositories and physically couldn't get them into his ass. Turned out he wasn't taking them out of the wrapper, which is normally made from really tough foil or plastic. Ouch. Well, I am a pharmacist, but I have one that would fit here. Female patient came into the pharmacy complaining that her NuvaRing, contraceptive that you place vaginally once a month, was too small. I was very confused, as these only come in one size. Then, I noticed that it was around her wrist like a bracelet, hair tie. SMH, I counseled her on correct usage and said she may need a pregnancy test. My mother, senior advanced practitioner, like a doctor but without a doctorate, told me a story from her youth when she was in ER on nights and a couple were brought in by ambulance by a sniggering crew. When they came into ER, he was walking backwards with a towel around his waist, whilst she was bent over underneath the towel. Turns out she was giving him a blowjob and got his foreskin caught in her braces. Lefts all round, nothing that a little local anesthetic injection and a quick snip wouldn't sort. Once separated, they took her away to remove the foreskin from the braces whilst he was stitched up separately. He was given the standard advance to keep it clean and to avoid sex for a few weeks until after the stitches had been removed. A heartfelt and embarrassed thanks by the couple was given to the staff, and off they went back home. They were back within an hour. They had tried to have sex and caused his stitches to tear. When a woman in an emergency room told me she was not going into labor because her app said she wasn't ready yet. I could see the top of her daughter's head, but what the fuck do I know? Keep asking Apple for advice. Teenage male patient came into the clinic with his girlfriend because he was growing breasts with milk production. Turns out his girlfriend was giving him her female hormonal birth control pills for extra protection. This isn't about a patient, but about a medical student. My mother knew, but I wanted to say it because I thought it was really funny. My mom and her group were making rounds looking at patients and diagnosing them with a doctor. The doctor takes them to a mother and child where the child suffers from some sort of condition, where his left eyelid droops down and covers half the child's eye. The doctor asked the medical students, what does the patient suffer from? And one medical student raised his hand and said, Down syndrome, sir. The mother started to cry and scream because she thought her child had Down syndrome, and the doctor called the medical student a fucking idiot and told everybody to leave, so he could tell the mother that her baby didn't have Down syndrome. My father was an oncologist, and one of his patients was a semi-known religious leader in our country. More of a cult than a religion. After a round of chemo, said patient threw up, and one of the members of their congregation told them that God had intervened and they had thrown up the cancer. My father tried explaining why this was nonsense, but they nevertheless stopped treatment and told their congregation that God had intervened and destroyed the cancer. Needless to say, they died soon after stopping treatment. During oncology fellowship, I explained to a woman and her family that she needed a bone marrow transplant. I told them the donor would either be an unrelated match or a matched sibling. I also explained that oftentimes we can collect stem cells from the blood of the donor and don't need to do bone marrow harvests nowadays, which is when the patient's sister asked with a completely straight face, so can I donate my menstrual blood for the transplant? It literally took every ounce of my being to be able to answer her with a straight face and not collapse into a fit of laughter and simultaneous vomiting into my mouth. Thanks for watching. Share your story in the comment.